Dr. Eric Berg once said, "You can't solve a nutritional problem with a pharmaceutical drug." That simple truth holds especially strong when it comes to diabetes, a condition where the body's natural systems are overwhelmed and crying out for support, not just medication. As we age, our bodies begin to struggle with absorbing and utilizing the very nutrients that are essential for stabilizing blood sugar. This is why many seniors with diabetes find it so difficult to keep their glucose levels in check, even when they're eating well and taking their prescribed medications. The missing piece of the puzzle often lies in key vitamins that the diabetic body desperately needs, but isn't getting. In today's video, we're going to uncover the top 7 vitamins that every senior with diabetes must take. These aren't just random supplements. These are scientifically supported nutrients that help regulate insulin, lower inflammation, protect your nerves, and prevent long-term complications like blindness, heart disease, and kidney damage. We'll explain what each vitamin does in your body, why you're probably deficient in it, how it directly impacts your blood sugar, and the best natural food sources and supplement forms. And make sure to stay with us till the very end, because the number 1 vitamin on this list is often ignored, yet it may be the most powerful blood sugar regulator of all. If you're ready to take back control of your health and lower your blood sugar naturally, you're in the right place. Don't forget to like this video, subscribe to our channel, and hit the bell icon so you never miss our senior health tips. Let's begin with a vitamin that plays a crucial role in regulating blood sugar, vitamin D. Research has shown that people with low vitamin D levels are far more likely to develop type 2 diabetes. Why? Because vitamin D does more than just strengthen bones, it actually helps your pancreas produce insulin and improves your cell's sensitivity to insulin. Without it, your body struggles to keep blood sugar stable, especially after meals. Now here's the alarming part. Studies estimate that up to 80% of seniors are deficient in vitamin D, especially those who stay indoors or live in colder regions. As you age, your skin also becomes less efficient at converting sunlight into vitamin D. Low vitamin D is linked to increased insulin resistance, more frequent sugar spikes, and a higher risk of diabetic complications, including neuropathy and heart disease. And for seniors, it can also worsen mood, immune function, and muscle strength. So what can you do? Start by getting your levels checked with a simple blood test. If they're low, consider taking a D3 supplement, which is the most active form. For most seniors, 1,000 to 2,000 IU per day is safe and effective, but always consult your doctor first. Natural sources include fatty fish like salmon and sardines, egg yolks, and fortified foods. But sunlight remains one of the best and most natural sources. Just 15 to 30 minutes a day on bare skin can make a difference. Vitamin D is foundational. Without it, your other efforts to lower blood sugar may fall flat. Now let's move on to another hidden powerhouse, vitamin B1. Vitamin B1, or thiamine, may not get much attention, but it's vital for seniors with diabetes. Thiamine helps your body convert sugar into energy, and without enough of it, glucose builds up in your blood, leading to fatigue, brain fog, and sugar spikes. Even worse, low B1 levels are directly linked to diabetic nerve damage, also known as peripheral neuropathy. According to Dr. Derek Lonsdale, a pioneer in thiamine research, many people with diabetes suffer from what he calls cellular hypoxia, where cells are starved of oxygen because they lack thiamine. This creates an environment of inflammation, nerve pain, and organ stress. Here's the kicker: diabetics lose more thiamine through urine. That means even if you're eating a good diet, you may still be deficient. Signs of low B1 include tingling in the hands and feet, memory problems, irritability, and muscle weakness. If you're experiencing any of these symptoms, it's time to take B1 seriously. Now, there are 2 forms of B1 to know about. Thiamine hydrochloride, the standard version found in most supplements. Benfotiamine, a fat-soluble version that absorbs better and is especially effective for nerve repair in diabetics. For seniors with diabetes, benfotiamine is often the better choice. The ideal dosage ranges from 100 to 300 milligrams per day, but again, talk to your healthcare provider before starting. You can also add more B1-rich foods to your diet: sunflower seeds, green peas, lentils, brown rice, and asparagus. When you support your body with thiamine, you'll feel more energetic, sharper, and experience better glucose control. Next, let's explore a vitamin that your medication may be quietly robbing from you. Vitamin B12. Vitamin B12 is absolutely essential for nerve health, brain function, red blood cell production, and energy metabolism. But for seniors with diabetes, B12 becomes even more important, and unfortunately, more depleted. Here's why. If you're taking metformin, the most commonly prescribed diabetes drug, there's a high chance it's silently lowering your vitamin B12 levels. In fact, studies have shown that up to 30% of metformin users develop a B12 deficiency over time, and many don't even realize it. Low B12 can lead to symptoms like numbness, tingling in the feet or hands, fatigue, memory loss, confusion, and even depression. Many seniors confuse these signs with aging, but they're often the direct result of B12 depletion. Vitamin B12 helps maintain the protective covering around your nerves and supports your body's ability to metabolize glucose. If you're low in B12, you're not just at risk for neuropathy, you're also making it harder for your body to manage blood sugar effectively. Now here's what makes things more complex. As you age, your stomach produces less acid, which means you absorb less B12 from food. So even if you're eating B12-rich foods like meat, dairy, or eggs, your body might not be absorbing them well. That's why B12 supplements are often necessary for seniors. The best forms include methylcobalamin, highly bioavailable and great for nerve repair. Sublingual B12, absorbed under the tongue, bypassing digestion. B12 injections, for more severe deficiencies, requires medical supervision. The typical supplemental dose is 1,000 micrograms daily, but consult your healthcare provider to tailor it to your needs. By restoring your B12 levels, you'll likely notice better energy, sharper thinking, and improved nerve function. It's one of the most powerful changes you can make for your overall health. Coming up next, we'll talk about one of the most underrated antioxidants for diabetics, vitamin C. Vitamin C fights inflammation and insulin resistance. Vitamin C is widely known for boosting immunity, but for diabetics, especially seniors, it does something even more powerful. It reduces insulin resistance and lowers chronic inflammation, both of which are at the heart of diabetes. A landmark study published in the journal Diabetes, Obesity and Metabolism found that just 1,000 milligrams of vitamin C per day significantly lowered fasting blood sugar and inflammation in people with type 2 diabetes. That's a major breakthrough. So, how does it work? Vitamin C is a potent antioxidant. It helps neutralize free radicals, those unstable molecules that damage cells and trigger insulin resistance. Diabetics often have higher oxidative stress, which leads to blood vessel damage, nerve pain, and slower healing. Vitamin C steps in to fight that stress head-on. It also plays a role in collagen production, which helps protect your eyes, skin, gums, and blood vessels, all common areas of concern for diabetics. But here's something most seniors don't realize. Blood sugar and vitamin C compete for entry into your cells. If your blood sugar is high, it blocks vitamin C from getting in. That's why people with uncontrolled diabetes are often low in vitamin C, even if they eat fruits and vegetables. Good dietary sources include bell peppers, guavas, kiwi, strawberries, and citrus fruits. But if your diet is limited or your sugar levels are high, a supplement may be your best bet. The typical dose is 500 to 1,000 milligrams per day, in divided doses to enhance absorption. When taken consistently, vitamin C can help stabilize your blood sugar, protect your organs, and support overall vitality. Next, let's talk about a vitamin that protects two of the most vulnerable areas in a diabetic body, the heart and pancreas. That's vitamin E. Vitamin E is another antioxidant powerhouse that diabetics often overlook. But it plays a crucial role in protecting the pancreas, heart, and blood vessels from damage caused by high blood sugar. In diabetes, excess glucose causes oxidative damage to the pancreas, where insulin is made. Over time, this damage can reduce insulin production. Vitamin E helps shield these delicate pancreatic cells, preserving their ability to produce insulin. It also protects your arteries. When your blood sugar stays elevated, it causes tiny injuries inside your blood vessels. Vitamin E reduces this oxidative damage, helping to lower your risk of heart attacks, strokes, and circulation problems. Major concerns for older adults with diabetes. Studies show that vitamin E may also improve insulin sensitivity, especially when combined with vitamin C or omega-3 fatty acids. But not all forms of vitamin E are equal. You want to look for mixed tocopherols and tocotrienols, the full-spectrum versions that offer superior protection. Avoid synthetic D-L-alpha tocopherol, which doesn't offer the same benefits. Natural sources of vitamin E include almonds, sunflower seeds, spinach, and avocados. But to reach therapeutic levels, supplements are often necessary. The ideal dosage ranges from 200 to 400 IU per day, unless your doctor advises otherwise. Vitamin E is especially important for seniors, as it supports brain, skin, eye, and cardiovascular health, while also reducing insulin resistance. Now, let's move on to one of the most overlooked vitamins for diabetics, especially when it comes to heart health, vitamin K2. Vitamin K2 may be one of the most misunderstood vitamins, but its role in protecting diabetic seniors is absolutely critical, especially for your heart and blood vessels. Here's why it matters. Diabetes increases your risk of calcification in the arteries, where calcium builds up in your blood vessels instead of your bones. This hardens the arteries, raising your risk of heart attack, stroke, and poor circulation. Vitamin K2 helps direct calcium away from your arteries and into your bones, where it belongs. It works in synergy with vitamin D3, so if you're taking D3, you should always pair it with K2 to prevent calcium buildup in the wrong places. The specific form you want is -7 Malawian kwaches, which stays in your system longer and is more effective at reducing arterial stiffness. Some studies have shown that regular intake of K2 can reduce the risk of heart disease by up to 50%. For seniors with diabetes, this is a game changer. Not only does K2 help protect your heart, but it also improves bone strength, an added bonus for preventing fractures and osteoporosis. Natural sources of K2 include natto, a fermented soy product, hard cheeses, egg yolks, and grass-fed butter. If those aren't in your regular diet, consider a supplement. The recommended dosage is 90 to 200 micrograms per day, preferably alongside vitamin D3. If you're already dealing with high cholesterol, blood pressure, or poor circulation, adding K2 may help improve your outcomes and reduce long-term complications. Next up, we'll briefly discuss two powerful honorable mentions, magnesium and chromium, and how they can make a huge difference in your blood sugar control. Would you like me to continue with the honorable mention, magnesium and chromium, and the final summary and recommendations section next? Before we wrap up, there are two additional nutrients that, while technically not vitamins, deserve a place on this list because of their powerful impact on blood sugar: magnesium and chromium. Let's start with magnesium. This mineral is involved in over 300 biochemical processes in your body, and it's one of the most common deficiencies in seniors with diabetes. Why? Because high blood sugar causes magnesium loss through urine, which then worsens insulin resistance, muscle cramps, and fatigue. Magnesium helps your muscles and nerves function properly, supports a steady heartbeat, and most importantly for diabetics, improves insulin sensitivity and glucose uptake into your cells. Good food sources include spinach, pumpkin seeds, black beans, and almonds. But many seniors benefit from a magnesium supplement, especially in the form of magnesium glycinate or citrate, which are easier on digestion. The typical dose for adults is 200 to 400 milligrams per day. Now, let's talk about chromium, specifically chromium picolinate. This trace mineral plays a key role in glucose metabolism. It helps insulin work more effectively by allowing sugar to enter your cells more easily. Some research has shown that supplementing with chromium can lower fasting blood sugar, reduce sugar cravings, and even improve A1C levels in people with type 2 diabetes. Sources include broccoli, eggs, and whole grains. But again, a small supplement of 200 micrograms per day may provide real benefits for diabetic seniors. While vitamins like D, B1, and B12 are foundational, magnesium and chromium act like support players, helping fine-tune your blood sugar management. Let's quickly recap the top 7 vitamins that every senior with diabetes should be paying attention to. Vitamin D enhances insulin sensitivity and reduces inflammation. Vitamin B1, thiamine, supports nerve health and sugar metabolism. Vitamin B12 protects against nerve damage, especially for those on metformin. Vitamin C, powerful antioxidant that lowers insulin resistance. Vitamin E, shields your pancreas and arteries from glucose damage. Vitamin K2, keeps calcium out of your arteries and into your bones. Honorable mentions: magnesium and chromium help support insulin action and glucose control. If you're a senior living with diabetes, addressing these nutrient deficiencies can be one of the simplest and most effective ways to support your health. But remember, vitamins are not a replacement for medical advice. Always consult your healthcare provider before starting any new supplement, especially if you're on medications. If you're unsure where to start, look for a high-quality multivitamin specifically designed for diabetics, one that includes these critical nutrients in the right forms and dosages. And most importantly, don't wait. Every small change you make today can protect you from serious complications tomorrow. Your body has an incredible ability to heal and balance itself when it's given the right tools. If you found this video helpful, please like, share it with a loved one, and subscribe for more senior health tips. Comment below, vitamin power, if you watched till the end. We'd love to hear which vitamin you're focusing on first. Stay healthy, stay strong, and we'll see you in the next video.